can GLP-1 agents really reduce inflammation in the body? So, welcome back to the channel. It's Dr. Durst, and I have my co host with me.
Hey guys, Faraday Goli, family nurse practitioner here at Revitalize MD. And we talk a lot about GLP-1s. Those are your Ozempics, your Mongeros, your Zepbound,
Wegovy.
the Wegovy, all of those types of injectables that are out there, the new hot topic. But what about how it relates to inflammation? There's lots of studies
Yeah.
showing a reduction. So how do these GLP-1s reduce inflammation and what do the studies show?
So, there is so much information out there on all digital channels about those weight loss agents that is all the rave now, right? People losing weight and they're all bad or they're good or the Ozempic face. But the bottom line is we are seeing a ton of really good, at least benefits. Overall, you hear people
Yes.
feel better, they lose weight. This is in and out of the office. I hear it, in social circles
Their blood
and
pressures are
yeah.
down. Their insulin function is improving.
Yeah, everything. And so, so from our standpoint, we use it, but they're always very regulated and we follow our patients very closely when we're doing anything. And so, what we did is after we hear these stories, look at some of the studies about inflammation and GLP-1s. And what we found is actually very interesting. So, 69% of the studies that are reviewed have a positive influence on decreasing inflammation. So actually
That's
decreases
crazy.
inflammation in the body. That's 70%. And then there was 32% that said possibly and really none with mixed reviews. And so that was significant. 9 papers actually show that it decreases inflammation.
So that is so eye-opening because we hear our patients say, I feel so much better.
Mhm.
I'm doing so much better. And you think, well, with the weight off, their joints don't hurt so much, their blood pressure is better, their metabolic function has improved. So that's why. But how much of it is actually that inflammatory those markers being affected as well?
Yeah. Well, and so that's the thing. I wanted to just see what those studies are. And I think we're going to look more and more, break them down as we run across it, because microbiome is another thing that came
Mhm.
up. And we run across some of those facts in these studies. But I think the key is just inflammation alone right now, today. 9 papers that show a decrease. What are the mechanisms for which it might decrease the inflammation? So there are direct effects on the receptor of so the GLP-1 receptors, there's direct effects that the expression of inflammatory markers is decreased just by those agents stimulating their receptors. So that's huge.
Just the act of injecting the medication,
Yeah, and the mechanism of that
that
action.
medication.
And again, you're giving the body back something that it's used to. So it's fitting into that receptor exactly the way that it should, like a key in a lock. So you're not giving it an agent that is different and somehow modulating effects in the body, but this is a direct receptor effect of the GLP-1
Yeah.
agents.
Guys, think about like a gear. Receptors fit like 2 gears or a lock and key.
Yeah. It's too complex for my brain to think about the gear part. Yeah.
I
I
just think it gives a
you're
picture.
you get all that stuff a little bit better than me.
Yeah.
And yeah, lock and key is about as complex as I can go. It's like people when they ask me what the different tools, like the screwdrivers. It's like
Oh, we can't go there.
straight or start. That's it. That's all I got.
Oh
So
my goodness. So what are some of these?
straight or start.
What are
But
some
the
of
other
these?
thing that it can do is just reduce the
Yeah.
circulating inflammatory markers.
And what are those markers?
So, like CRP, for instance, the
Yeah.
C reactive protein, that's one that they commonly will look at. Tumor necrosis factor alpha, interleukins, the interleukin 6. So, those inflammatory markers, but a lot of people will follow the CRP as a level of inflammation and will look for things that will reduce it. Like they know there's inflammation. So, obviously, there's things you can do yourself to reduce inflammation, but it's huge that this medication peptide that you are using not only is going to result in weight loss, but have other pleomorphic positive effects in the body.
Which is
Amazing.
pretty cool.
Yeah.
And CRP is C-reactive protein, and that is something that we can track through a simple blood draw. And that's looking at systemic inflammation in the body.
Yeah.
So it's a very easy thing to monitor and track.
So it'll be interesting as the studies come out
Yeah.
because even if you have an area of inflammation, you have chemotaxis and you have things that are drawn to it, and it decreases that, that draw or that attraction,
Yeah.
and in the signal that goes out to bring those inflammatory markers to that area of inflammation. So it decreases that too. But also, if you're just looking at like immune or inflammatory effects, it actually surpasses in some of these studies the effects of a nonsteroidal anti-inflammatory. So, like an ibuprofen or the
That's
naproxen,
huge.
something else that you're getting for inflammation. These decrease inflammation more in some of those studies. So, it
So really what
outperforms.
she's saying is it's more effective than Advil is
Yeah.
what some of these studies are showing, that cytokine suppression.
Yeah, it actually works and outperforms when it's comparing that inflammatory or anti-inflammatory effect. It also showed just from a overall chronic disease that, diabetic markers, obviously the inflammatory markers in a type 2 diabetic are decreased. So is the insulin sensitivity. When you look at heart disease, it actually decreases, again, inflammation related to heart failure. So as we get older, our hormones decline, and most of the time, inflammation in the body is increasing. That's what happens in most disease. The root cause is inflammation. So, if you can decrease weight and decrease inflammation with these, and these are just studies we're reviewing that are pretty eye-opening and significant.
It's
So,
really exciting to see
mhm,
where these medications go.
yeah. Well, it'll be exciting and it'll be like a very interesting course because
Yeah.
you already see lots of mixed information, but I think that there's such good studies out there and solid studies that are showing positive benefit that we have kind of promoted the bad diet, the bad American diet, and
Mm.
we have people that question what the safety of again, things that aren't drugs or medications, and yet we have people on medications. We haven't questioned McDonald's or fast food. We didn't even close that down for COVID.
Alcohol's legal, and we know the
Yes.
havoc that wreaks on the body.
Yes. And so there's just so many different things that we've kept people almost in that unhealthy mentality and dependent on drugs and medications. And when we can start looking at lifestyle habits that will decrease inflammation, improve overall health and health span, and now a medication that actually decreases obesity and
And inflammation?
inflammation and potentially affects, the GI tract in a positive way as well. I mean, so it'll be interesting to see how that plays out with guidelines and studies and all of that
And there's a
because,
lot coming out on like microdosing. How is
yeah,
that going to play into this?
yeah,
And are they going to do studies on that?
yeah.
That's what I would love to see.
And so there's, again, conventional agents that are approved. There's peptides that are compounded to simulate that same amino acid sequence that's in a medicine, insulin being the first peptide, just so you know. So it goes back to, the early 1900s that or at least mid 1900s, that we had a peptide that we knew to work.
Hmm.
And so now we have another one. So whether we limit that where it's only insurance based or covered or super expensive or those manufacturers can't keep up, or while we allow and open that healthy, option to compounding pharmacies and peptides and not regulate that as much. So it'll be interesting to see how our governmental agencies work with the FDA and with compounding pharmacies overall, just to make sure that you can also use this as a microdosing and
Because
healthy
that's not
option.
conventional.
Hmm. Yeah,
And there's a lot of promising information that's coming out on that too.
yeah,
So if there's studies, we'll review those.
and one size does not fit all, and that's
Yeah.
frequently what you get with a conventional. It's a one injection. So it's good to be able to adjust the dose and customize it to a patient. But just all very interesting conversations, well worth having. Let us know if you have anything related to the GLP ones that you want us to review, or
Your
anything else you want to
experience.
talk about, your experience, because we are willing to deep dive into anything wellness or sexual wellness.